Look, health care. This healthcare debate's been hard on my health, I got to tell you. It's estimated that improper payments cost taxpayers almost $100 billion last year alone. Think about that. That, by the way, just that abuse in improper payments is more than we spend on the Department of Education and the Small Business Administration combined. If we created a Department of Improper Payments, it would be one of the largest agencies in our government. Now, for the past few years, there's actually been a pilot program that uses a system of tough audits to recover some of this lost money. And even though these audits, they were just operating mainly in 3 states, they already found $1 billion in improper payments. So these results were both disturbing and encouraging. They're disturbing because it shows you how much waste there is out there in the healthcare system, but it's encouraging because we can do something about it. So earlier today, with Claire looking over my shoulder, one of our auditors in chief, I signed an order calling on all federal agencies to launch these kinds of audits all across the country. All across the country. So, agencies would hire auditors to scour the books, go through things line by line. Auditors are paid based on how many abuses or errors they uncover, so it's a win-win. The auditor, if they do a good job, they get a small percentage as a reward, and the taxpayer wins by getting huge sums of money that would otherwise be lost that we can then spend to provide care to people who really need it, or we can use to reduce the deficit. Now, through this effort, we expect to more than double the amounts we would have otherwise recovered. A couple $1 billion over the next few years. And I'm announcing my support for the Improper Payments Elimination and Recovery Act. That's a mouthful, but this is a bipartisan bill. It's a bipartisan bill to expand our ability to do these audits so we can prevent even more fraud and abuse and waste. Now, the reason I'm bringing all this stuff up is because there's been a lot of talk about health care lately. And look, I'll be honest, a lot of people they're confused. They're saying, well, how can you help people get insurance who don't have it without it adding to our deficit? It's a legitimate question. Well, the reason is because so much of the money currently in our health care system is being misspent. Look, if you've got a house and the roof is leaking and the windows are all, letting through a bunch of draft, and you get that cold winter and all the heat seeping out, and if you decide to spend on some new windows and to fix your roof, that's going to spend a little money, but you'd save money in the long run because you don't have heating expenses and that those leaks aren't ruining your furniture. And the same thing is true with our healthcare system. We've got leaks everywhere that you pay for, directly or indirectly. And if we can have a smarter healthcare system, then yes, we can provide help to middle-class folks who need it, and at the same time, actually reduce the burden on taxpayers. Now, I know that during the healthcare debate, opponents have tried to scare people, especially our seniors, into thinking that we are going after seniors' Medicare benefits. That's how Obama's going to pay for his plan. When you look at the facts, that's just plain wrong. In fact, by saving billions of dollars of the sort we just talked about, waste and abuse, in Medicare, reining in waste and inefficiencies, we're going to be able to help ensure Medicare's solvency for an additional decade. And this is This is just one example that speaks to how we're going to stop wasting money through the healthcare system on things that don't make people healthy. In fact, often take away from the care we receive, and take that money and make it work for the American people. So Medicare will work better, provide better care because of these reforms. Senior citizens who are dealing with the donut hole in the prescription drug plan, that plan will be filled in part because we're not wasting money on stuff that doesn't work. That's common sense. You know, I get a lot of letters from constituents. I get about 40,000 every day, and I don't read all 40,000. Somebody does. But what I've done is I've asked my staff to collect a sampling of 10 letters that I read every night. And I will tell you that my staff is very even-handed because about half of these letters call me an idiot. Yeah, and at least half of them talk about health care. And when the health care reform debate was really heating up, one of the things that I heard from a lot of seniors was, keep your government hands out of my Medicare. I heard this from a bunch of seniors. They say, I don't want your government-run health care plan, and don't touch my Medicare. And so I'd have to write back and I'd say, ma'am or sir, Medicare is a government program. But we're not going to weaken it. We're going to make it stronger. But I think those letters tell you something about what's sometimes happened in this healthcare debate, because people have been hit with a lot of bad information. And healthcare is really important. And so people get worried and they get nervous. But when you get past the divisive and the deceptive rhetoric, it turns out that most Americans are happy that 2 generations ago we made the decision that seniors and the poor should not be saddled with unaffordable health care costs or forced to go without needed care. That was a decision that we made decades ago, and it was the right decision to make. And by the way, when we made those decisions, folks were saying the exact same thing about Medicare. That's socialized medicine, this is government-run care, and blah, blah, blah. Now, today we face a different choice, but it's a similar choice to the one the previous generations faced. And that is whether we should help middle-class families and business owners that are being pummeled by the rising costs of health care. See, back when the Medicare debate was taking place, seniors were having problems because they were no longer working, and people were getting their health care through their jobs, and so it made sense to help them. It made sense to help the poor who might not be employed. But back then, middle-class folks, they were pretty secure. If you were working, you had health care that was affordable. But you know what's happened over the last several decades. What's happened is that more and more businesses are saying we can't afford to provide health care to our workers because the costs are skyrocketing. So they just drop health care altogether. A lot of small businesses, they don't provide health care to their employees anymore. And large businesses, what are they doing? They're saying to you, we're going to jack up your premiums, we got to increase your deductibles. If you're self-employed, you are completely out of luck. If you've got a pre-existing condition, you are completely out of luck. And by the way, those of us who are lucky enough to have health care today, we don't know if we're the ones who are going to lose our job tomorrow, or suddenly it turns out that our child has a pre-existing condition, and we'll be stuck in the exact same situation even if we've got good health insurance. Now, everything I just said, if you talk to my opponents, they'll agree. They'll say, you're right, the healthcare system's broken. For too many people, it's getting worse. They will acknowledge that the status quo is unsustainable. But you know what they tell me? We had that big healthcare summit. I know you guys watched all 7 hours of it. Yeah, absolutely. It was scintillating. But you heard what they said. They said, well, we agree with you, the current system's unsustainable, but this is just not the right time to do it. They said, let's start over. That's what they said. We just got to start from scratch. Well, let me tell you something. The insurance industry is not starting over. They just announced a 39% rate increase in California.